Hey everyone, we're gonna record this meeting and get it posted to the web. So please be advised, anything you say or share is subject to being on the web.
Thank you, Shelley.
Thank you.
Okay, so for those of you who are just hopping on, I'm trying something a little different with attendance. There's a link in the chat to a spreadsheet. If you can hop on and just put your name and your facility, that would be awesome. Let me know if you have any issues. Okay. Pull up. Thank you, Shelley. All right. So welcome everyone. Thank you for coming. So the only outstanding items we had for last meeting were the RFP was awarded now that we've sent out communications, but for purposes. So the RFP was awarded to ESO Solutions. So very happy the RFP is done. So yeah, hopefully that's not news to anyone. Let's see. Data, our next data submission is due on July 1st. Make sure you're doing your corrections of receiving them, and make sure you're going to be expecting those email reminders those out. You guys, I'll commend you for most of you have been very, very timely. Our numbers for people being on time have been really, really great. So let's see, we have questions. Okay, Debbie and Cassie, no worries. I'll have if you're having issues, just say that on the chat and then I can go in and add your name later. But I have it in the chat and I'll take some screenshots of that. Shelly will for me. Awesome, thank you. And this, just a reminder, so first quarter data is our next data that's due on July 1st, and that will be submitted to the ESO patient registry. And that goes for if you're on the ESO patient registry or if you're on the non-web old Trauma 1. So for those of you that are on the non-web Trauma 1, even though you're not entering data into that system, you still have the ability to submit data. It's very similar to you're submitting data to NTB, TQIP. But there will be trainings on that, and I'll send out data or info on that later. Any questions on that? So for those of you that are just hopping on, there is a spreadsheet in the chat. If you can click on that and put your name and your facility so I can use it for attendance, that would be awesome. Okay, so one of the questions that I have from one of our users was how to capture activity codes. So I wanted to go over this because I think some of you kind of think you have to have an activity code for every single patient, which is not the case. So save you a little bit of work. So activity codes, if you look down here, my thing is on this page. So it says, not applicable should be used when coding a motor vehicle event or other injury event that does not apply to a code in the activity list. So if you have a patient who had a fall or kind of a very nothing crazy trauma, you don't have to have an activity code. Those activity codes, the way I usually explain them is if someone's playing basketball or there's skiing or there's a very specific activity involved and there's an activity code that fits it very well, that's when you use the activity code. So don't kill yourselves trying to find an activity code that matches your ground level fall or whatever, or any type of MVC, because it doesn't have to always have an activity code. It always needs to be filled in. You can put not applicable, but it doesn't have to have one that matches. Does that make sense? Great. Okay. Jasmine. Okay. Jasmine, if you are talking, you may be muted. All right, let me know if you have a question. Okay, yep, no worries. And if there's ever a trauma that you're not sure if there should be an activity code, you can always email me and we can look at it and see if there's anything that fits. Okay, so I had another question on EMS vitals. there was a question whether or not there was a time frame on the vitals. So I think in the past there was maybe some rules in place, or they within 30 minutes or an hour of this or that. I will just go by what the data dictionary says, because that's the documentation that I have. So as far as EMS vitals go, it just says the first set of vitals. It doesn't say within 30 minutes. It doesn't say any time frame. So it's your first set of vitals. So I know a lot of EMS spreadsheet or run sheets, it says, at 8:04, this was the blood pressure. At 8:10, this is GCS, that kind of thing. It doesn't have to be all the same time. You just take the first of all of the vitals that we capture. Does that make sense? Any questions on that? Awesome. Okay. All right. So, but I wanted to clarify, because we like to keep things confusing. So for the ED vitals, it is within 30 minutes. So it's your first recorded set of vitals within 30 minutes. So again, they don't all have to be all the 8:05 vitals. It can be 8:05, 8:10, 8:15. It just needs to be within the first 30 minutes. So I wanted to make sure there was no confusion with that. Any questions? All right. Okay, so I wanted to go over pick lists and the new patient registry. I know some of you are not on the patient registry, so this will just be information for you guys. Let me go ahead and share my screen. You guys are quiet today. That's okay. All right. Okay. So the first thing, this is like my test registry environment I have. So none of this data is real patient data. So I want to show you guys how to, for the transfer delay reason, it's missing bed availability. So I wanted to go in and show you guys how to add a pick list, because I still get quite a few questions on that. And I think I talked about this last time, but the big difference between this registry and Trauma 1 with pick lists is I can do the pick list updates for Trauma 1 just for everyone, whereas it'll be if you're a full data set facility, you're going to be doing your own pick list updates. So everyone should kind of have a little bit of background as to how to do those pick list updates. Those of you who are a reduced data set and I am your admin and I've been working with you, I will all update your pick list. So, all right, so you're going to go, I'll start from the beginning. Okay, so you're going to click on registry. And if you click on this and you do not have, let's wait for it to load, this little wrench down here, that means that your privileges don't include like an admin privilege. So that there's probably an admin for your facility that has this. So click on the wrench. And then you're going to go actions, view. Okay, so org submission, this is which organization you're submitting data to. So if you submit data to TQIP and TDB, those are turned on. But then down here, you'll see there's Arizona reduced data set, Arizona full data set. And then it's all of your fields. And then down here, we're looking at lists. So list is pick lists. So we are looking for transfer delay reason. So transfer out reason. Okay, so go to actions, view. Okay, so we're looking to add bed availability because we had that in Trauma 1, but it's not on here. So you can add an encode to any of these options, but because bed availability doesn't really fit with any of these, I mean, resources unavailable, we can put it under, let's put it under resources available. It could go under other, but I think resources unavailable makes sense. Did I have a question or just someone hopping on? Okay. So you go add encode 16-1. bed availability, and then spell it right, and then add. And then when you do the first change to your template, it takes a little bit of time because it's essentially cloning your template. So you have the real one saved, and then this one that you're editing is kind of in the not published mode. So it takes a little bit of time. All right. Give it a minute. Is everyone excited for it to get hot? I am not. I'm sad that it's, I'm excited that we have a little bit of cooler temperatures this week, but I'm not looking forward to it getting hot. Alrighty. And then once it's done, oh, it didn't work. All right. So for whatever reason it didn't work, I'll reach out to Jody and ask him about it, but usually it works. So you can go ahead, it'll say that it was successful in adding the pick list option. You're going to go up here and hit publish. Do I have a hand up?
Chris,
Debbie, go ahead.
me. Sorry, mine didn't upload either, and this is just not an issue of today. I'm sitting like 2 weeks in behind that nothing is being published on my registry. Like nothing. Everything is
Any
failing.
of the data?
Yeah,
any of the data saving or your
every single time we have to update a list or do anything updated, it's always showing an error. Even since our last meeting with ESO, where we were supposed to go in and switch off our Arizona, the full list, switch it back on so we could get those trauma reasons, you know, those 45 reasons that we had to add for trauma activations. I have not been able to do that. I cannot even switch off, update, or anything my registry. My ESO has had the ticket since last week.
Okay, thank you for letting me know. I will reach out. Can you send me your ticket number that you've sent in so that I can have that to reference when I reach out to Jody and Jessica?
Okay, thank you.
Thanks, Debbie. Okay. All right, Heather. Okay, so it looks like people are having issues publishing in general, so that's good to know. I'll reach out to Jody and let you guys know what he says.
Hey, Carissa, it's Heather.
Hi, Heather.
No, it did allow me to publish it. So I got the same error message as you, but then it did add it to my tick list and did allow me to publish it.
Okay, so you got an error, but it
even though I got the error, I still put it on there under the
Okay.
resources.
Okay, that's odd. Okay.
You were using the patient request, so I'm wondering if that's why I didn't add for you, but because you hit the wrong one. But
I hit the
on
wrong
resource
one.
available, I was able to put bed availability 15-1. I got the error and then I waited a minute and then it popped up and it allowed me to publish.
Okay, I'm gonna try it again on 15, the correct one, because you guys are right. I clicked on 16. And we'll see if that works, but I'll follow up. Is anyone else having the same issues as Debbie with just not being able to make any changes to their template? Okay, make sure and definitely let me know if you're having those kinds of issues. Debbie will follow up on that. Okay, so while we're waiting for that to see if that works this time. Okay, thank you, Debbie, I got that. If you have any pick list options that you can't edit that don't match the ASTR data dictionary, you can put in a ticket to ESO to have them update those, but they should be, let's see if that worked. Did we get it? They should have gone in and updated all of you who opted in to have them match your pick lists. They've completed that, so if you don't have them matching, let me know. We can get that taken care of. Okay, let's wait for that. And then also, so for those of you who weren't at our last ESO meeting, so the triage criteria pick lists have been updated. So those missing options are in there now, but you do need to go in and turn them on. So I'll show you that after this finishes cloning. Okay, so it's just maybe because we're all trying to clone our templates at the exact same time. But let me know if it doesn't work for you guys, because we'll wait for mine. Okay. Debbie, go ahead.
Sorry, Carissa, I know I'm moaning this morning.
Nope, you're good.
But like you said, it's taking its time because we're all working on it.
Yeah.
This ESO has been so slow this last week.
Yeah.
It is not saving stuff that you're entering. You're waiting. If you're having to refresh your page, you're waiting forever for the page to refresh. It is pathetically slow. And ESO can't say it's because there's a lot of people working on it, because yes, there are a lot of people working on it. We're doing our jobs.
Yeah.
So they really have to start speeding up their system, because it's extremely frustrating.
Okay. Yeah, no, I've heard that. I got an email yesterday about that, and it sounds like that's a problem across the board. So thank you for letting me know. I know we have some members of the ESO team on the call, so they're hearing that feedback, so that's good. But I'll make sure and let Jody and Jessica know. I'll submit a ticket, and then also talk to them at our weekly meeting about how slow it is. Okay, so it looks like it worked. So it's just everyone on there at the same time. It's not working well. Okay, that's not. Give it some time. Okay. So we'll come back to that. Oh, bed availability. It worked. We still need to publish it. So the other thing I wanted to show you was, let's see. Okay. So we're looking for the triage criteria list for the EMS agencies. Come on. So much searching. There it is. Okay. So see how it says 25 out of 45? We need to go in and turn on those extra 20 that they added that were missing. So if you go down here where it says 20, it's only showing you 20 at a time. If you click on 100, it's easier to just knock it all out. So you can just go in, because it's making that copy. We'll wait for that, and we'll go ahead and finish that after it's done. But what I wanted to point out was when you do that, you need to go back to your organization that you submit to and toggle it on and off, so it's showing you those pick lists that have been added. So then after that, you can publish it, because if you go in there and you're only seeing 25, the ones that they've added, you need to go in and turn that on and off so you can see it. Okay. We'll wait right now to make those changes because I think it's really slow. But what I'm talking about is this org submission right here. Okay, so if your reduced data set and this is on, turn it on and off so that you're going to see those pick list options. Same thing for if you're full, turn it on and off so you'll see those pick list options, and then you'll publish it after you turn them all on, just like the others. So let me know if once everyone isn't doing it at the same time and you go to make those changes, if you're still having issues, let me know. I think it should still work when we're all on here, but I will make sure and submit a ticket and express those concerns. Okay. Any questions on updating pick lists other than it's not letting you publish? Okay. All 45 on. Yes. Okay. Let's share this instead. Okay. So for the registry discussion, the other thing that I wanted to point out is your state patient record number. If you guys remember that from Trauma 1, we don't have that in this system because this generates the registry number versus the state patient record number. So you can turn that off in your in your fields in that same place that we were just at. So everyone can go in and turn that off unless you're a reduced data set and I'm your admin, then I will go turn that off for you. I know we've just been either leaving it blank or entering in their medical record number, but that can be turned off. We didn't have the ability to turn it off, but now we do. I also want to talk about the EHR linkage capabilities. So those of you who have Epic or Cerner, they do have those linkage capabilities available. I talked to Jody and he said if your facility is interested in looking into that and starting to work with your IT team, email Jody and Jessica. Actually not Jessica, Julie and Jody. And if I can put their emails in the chat, but they can help you kind of get the ball rolling for that. And actually I'll include their emails in the minutes and the follow-up email. That would be easier. Okay, so recent validation changes and updates. So there have been a lot of, I'm not sure if it needs to be a specific version. I can follow up on that and let you know. But I haven't heard about a specific version, just that it needs to be Cerner. Yeah, thank you. So if you've been attending the bi-weekly meetings or bi-monthly meetings, there have been a lot of validation changes. There shouldn't be, it should be included in the state contract for the RFP. And so there's going to be a big round of updates on the 28th for mostly for the reduced data set facilities. There's some validation flags that are turned on that are only for full. But if you have any, if after the 28th, you're still seeing a lot of validation flags that shouldn't be there, make sure and let us know. But I have a big list of the recent validation changes that I'm going to go ahead and send out. We've gone over them at all of the recent meetings with ESO, so I don't think we need to go over them today, but I will send those out. And I think that'll be helpful to have so you can see this will be turned off on the 28th. So if you're still seeing that, you can know that it's not you. You don't need to spend your time trying to fix that. Okay, so next steps. As I mentioned, everyone, regardless of your system, will be submitting data to the state and the ESO registry. And so Jody and the team will be working on providing training on how to submit your data. I've seen kind of the platform and the way that you do it, and it seems very similar to TQIP and TDB, that kind of thing. So basically, you'll submit a file, you'll run the validation. They'll tell you if there's anything that needs to be fixed, but we'll have a much more in-depth training. So we'll make sure and send out info when we're going to be doing that. And then in July, we'll be starting the legacy data migration with ESO. So our old data in Trauma 1 will be put into the new system. Any questions on these things? I think I got the questions in the chat. Okay. Okay, so I had a few miscellaneous questions after the agenda that I wanted to add in. So one was who counts as a first responder? So if they show up, do they count? Do they need to actually touch the patient? Do they need to have a run sheet? And we really don't have a definition in the data dictionary. So I will share with you what I think, and you guys can tell me if you have any strong differing opinions. So I think sometimes in a run sheet on the transporter, you'll see like, this unit showed up and that will be it. I think that there needs to be documentation of them doing some type of vitals or some type of work on the patient, or if there's a run sheet that needs to be there. So you have that information to count them as a first responder. If it's just their name mentioned and nothing else, you don't know what they did. You don't know really what their role was. So I think that needs to be kind of the bare minimum of what you have for information. Does that fit right with everyone? Does anyone have any other thoughts on that? Okay. And if it's ever, again, if there's ever a situation where you're not sure if it should be included or not, or whether or not this is a first responder, you can always email me and we can look at it. And then I had someone else. PTA. So you're saying that it says that it was the first responder? Yeah, I think if they did vitals, they can be included because then they were kind of working on the patient is my opinion. And again, we don't really have anything in the data dictionary. I think that just for consistency's sake, make sure it makes sense that they were actually contributing to the care of the patient. Does that sound good? Okay. Okay, I had someone who was going to the ESO WAVE conference and they were wondering if anyone else is going because they wanted to have someone to sit by and to chat with from Arizona. So is anyone, I don't get to go, I'm saddened by it, but is anyone else planning on going to the WAVE conference? Okay, I don't remember who'd asked me this, but if you're on the call, you're just gonna have to go make friends from out of state and make a friend in Hawaii. You can go visit or something. Okay, so next was I had a question about NA versus and not documented for secondary payer. So our data dictionary, let's see, says not documented should be used if method of payment for this visit is unknown. Not applicable should be used if payment did not have a secondary form of payment for this visit. I think this is kind of tricky because there may be a second method of payment that you don't know about that's just not documented, but I think just use your best judgment. If you're only seeing Blue Cross or you're only seeing Medicare, I would just put not applicable because you can't assume that there's a second one. That's just not documented. So that's that. Any questions? Okay. All right, so we are going to be having an ESO in-person training. So it's going to be on Wednesday, May 28th and Thursday, May 29th. It'll be at Honor Health Osborne. So really, let's see. Okay, let's see. All right, Sharon, I'll ask Jessica and the ESO team about it because we should be able to put not applicable. So thank you. I will follow up on that. Okay. So the way that we're going to set it up is the first day, Wednesday, will be for full dataset users, and the second day will be for reduced dataset users, just because there's going to be, at least part of the training will be focused on report running and that kind of thing, and there's different needs depending on the dataset that you submit. Yes, so Danelle, but do you put NA or not documented? If there's not. Okay, so I think it should be at least filled in because we don't want to have any blanks. That's in the data dictionary. I don't think it says it can be blank. Okay, so I would be putting not applicable or not documented. Okay, yeah, you should always be filling them in. Let's see. Yes. Okay, so that's Maria. Hold on. Okay, yeah, Maria, I remember that now. So we need to follow up on why it's not liking NA for secondary payer. Keith, I need to go, I don't know off the top of my head. I would need to go in and look at a record. I don't think so, but I'll follow up with you. I'm not going to give a solid answer without looking at it and seeing what the system does, but I'll follow up on that. I know it doesn't come up as an error, but when we run, ideally it would be mapped, yes, but if it's not, when we run a report and we see blanks mean, is this missed or was it really meant to be blank? So we try to avoid blanks. So I can work with ESO to have it mapped as NA if not entered. But I don't think we tried to avoid any type of blanks. But I'll follow up with Keith on NA for pre-hospital incident fields. And then we will, I don't know if we'd even want it mapped as NA because at what point do they know if it's left blank? We don't want it mapped as NA because maybe someone just forgot to enter it in, right? Would be my my thought. Anyways, any other thoughts on that? I understand it would be helpful if it's autofilled, but for the autofill, how does the system gonna know if it's supposed to be NA or if that you just haven't entered that in yet? Save, add secondary payer button. Okay. Danelle, so you're saying that you can't add a secondary payer? Nicole, you're saying that when you run reports, they auto-populate as not applicable if you leave them blank. Is that right? Okay, I am going to look at that to see if you run or if you leave it blank, does it auto-fill to not applicable? Okay, I'll look into that because I don't know off the top of my head. And then I'll also look up Keith's question just to make sure. The in-person training, we will have an option to broadcast to people who can't attend, and we will record it. Okay. All right. We'll follow up on the chat questions. And if you have any more in-depth questions, you guys just come off the chat. It'll be so much easier than the chat. I think that'll be easier. Brandy, yes. I can ask you, I can stay on after the meeting.
Hey, Krista, it's Heather. Where do you find that state record number to turn it off?
It should be.
What's it listed under in the list? Because if you type in record number, nothing comes up. If you type in state, it's not listed in any of those menus that I have.
Okay, so are you in fields?
Yes.
Okay, so let's see. And then pop up for state. State, okay, so it should be this state patient record number.
Okay, thank you.
Yep. Then just turn that off. Okay. Can I show? Yes. Okay. We'll go to the registry. Okay. Okay, so primary and then secondary. Not applicable. So that should be the secondary not applicable / not documented if you don't have any info on how or what their payment methods are. Did that help, Lynette? Okay.
Hey,
Okay, were there any
Krista,
other?
if you delete that primary and then re-add it, there's the save and enter new payer button. That's the one I'm talking. That doesn't work. If you delete that one,
So it delete secondary or delete primary?
you can delete both and then go and add a primary.
All right. All right. Okay, so this add
Yeah. So enter primary.
primary. Okay.
Okay. Then
So which-
save and add new payer.
Okay.
Now enter new payer.
Okay. Okay.
you
So
click on
it's
it,
the
it
primary
doesn't work.
or not the secondary.
So then you have to add it again.
I see. So then you have to do add pair, secondary. Okay. I see. Okay. Let me take a note of that and submit a ticket.
I did submit a ticket and then they said they resolved it and it's not resolved.
Not resolved. Do you have that ticket number still handy or did they close the case?
I can try to find it.
Okay. If you can't find it, just email me and let me know and we'll submit another ticket. Yes. So Lillian, if right now, if you put NA for secondary, you're getting an error, but you shouldn't. So we're going to submit a ticket because NA and not documented should be acceptable. Okay. Okay. Thank you for letting me know, Danelle. That makes more sense. Okay. All right. So the in-person training, Wednesday the 28th full, Thursday the 29th will be for reduced. So I want to know, I'll be planning with ESO to kind of to plan the training. What do we want to go over? What do we want our goals, objectives to be? So I have a Google form that I want to share with you guys to put what you want to get out of the meetings, with the trainings, what topics do you want to be covered? So it's right here. Let me put it in the chat. And then I'll also send it in the follow-up email. Danelle, I know that it won't be in person only because I know a lot of people work either remote or if they can't attend. So we'll have a virtual option as well. Okay, thank you, Danelle. Okay, so give me your feedback. There's only 2 questions. I just need to know if you're going to be there for reduced or full, which data set you are. And what do you guys want to know? What kind of topics, that kind of thing. Any questions on that? And it'll be Jody who will be our trainer. So you guys are familiar with him and he's familiar with our data set. So I think that'll be really great. But yeah, we, as always, definitely want your feedback so we can make it the most beneficial and worth your guys' time. All right, that's all I have. I did get CE credit for this for ATS. So I will send out they just gave me a spreadsheet this time, which was a little different from last time, but I added a little section at the bottom so you guys can put your name. So fill that out, put your name, and then send it to mriley@amtrauma.org for the CE credits. Any other questions? Beth, go ahead.
On. Okay, I had to unmute me, sorry. Did I understand you correctly on the information page, we're supposed to turn off that state patient record number so it just doesn't show up because we don't put anything in there?
Yep.
Okay, thank you.
It was an autofill for Trauma 1, but there's a different field that basically takes that field's place, so we don't need that in the new registry.
Perfect, thank you.
Okay, and then it says name not available. Someone's raised their hand. Go ahead.
Hey, Chris, it's Heather. I emailed you from Kingman. I emailed you yesterday, and I don't know if anybody else is having this, but under the AIS 15 documentation, there's no way to code like a non-injury. So like say we have a high risk motor vehicle accident rollover, there's no injuries. And we're able to do on the ICD-10 code, we're able to put in that like the motor vehicle accident, but on the AIS 15 code, I'm getting an error because there's nowhere in there. It doesn't allow you to put a code that's non-injury. I don't know if anybody else is facing that.
So I think we were working with ESO so that we can put not applicable for those instances where people don't have any codable injuries, because that happens. I can't remember if they already did it or not because there's so many things we've been working on. Has anyone else had success with putting not applicable for your diagnosis codes, or is that going to be rolled out in the next? I'll follow up with you on that, but we should have the ability to put not applicable.
Yeah, I went through that entire build launch code builder, and
Yeah.
I'm telling you, I spent like 2
Yeah.
hours yesterday, and there was nothing in there.
Yeah.
That was not applicable. So
Okay, yeah, that's something we're working on, so ESO is aware of that. So for right now, you can just leave that, and then we'll be able to put not applicable for those. Yep. Yeah, if there's, you can disregard the error message if you have no diagnosis for now. We're working with ESO to have that removed for patients that don't have any codable injuries. Okay. Tara, I don't have a set time yet. I'm still working on the details with ESO and Honor Health. But I'll send out a more formal, informative email. I just wanted to let you guys know. And I know I'll have Shelly send out an email to kind of everyone so that everyone's aware of it. Okay. Any other questions? Beth, go ahead.
I was just listening in on the diagnosis codes of the not applicable. If we leave that blank, isn't that a level 2 error and you can't lock the chart, because then you might fall out of the 60-day thing because it reads from the 60-day fallout, it goes by when you lock the chart.
So there's some debate as to what counts as the 60 days. But yes, so we're working on so that that error doesn't happen and keep you from locking the chart. So I'll follow up with you guys on that, but it should be, you should have the ability to either not get that flag when you don't have a codable injury or to put not applicable in the diagnosis section.
Okay.
Okay. Training a full day. Again, I'm not quite sure. It's not going to be 12 hours, but I'd guess 6 to 8-ish hours maybe, but I'll follow up when I have more details. But I hope everyone can come. It'll be great. It'll be good to see everyone since we don't do TRUG in person. Alejandra?
On the reduced data sets, is there, because I haven't been able to lock any of my charts like back from January. I know you had said that some of them were flags that weren't supposed to be there. Do you know, like, are we going to get dinged for not locking these charts in time?
No. Well, data's not due until July 1st, but as a reduced data set, you don't submit data to NTDB or anything like that. But the big round of updates for the reduced data set will be on the 28th. So a lot of your flags you're getting, I know we've met and looked at them, are ones that just need to be turned off. And ESO is working on turning those off. So you're not going to get dinged, anything like that.
Thank you.
Jennifer?
Hi, sorry, I may have missed it. Is there going to be a streaming option for those one-day events?
Yes.
Thank you.
And Krista, one other quick question for Heather. Do you have, so for the data submission, I know you're going to do some training on that. Do you have to lock those records before they'll submit?
I don't know. I think that they need to be locked because if they have flags, the record will flag as saying, hey, this is not working. But I need to talk to Jody about it, whether or not, because you could have just completed all of it and there's no flags and not locked it. I don't know if that will reject the record or not, but I'll ask Jody about that.
Okay, thank you.
Can we remove full data in order to lock the chart? Lynette, can you kind of elaborate a little bit on that one?
I'm talking about the submission organization. So like if there's no new injuries to code, can we just remove the submission organization title just to lock the charts?
No, that won't work because then you need to turn that back on in order to submit data. So that will kind of mess up the system.
Gotcha.
Beth?
Do we sign up for that ESO training somewhere or just?
I don't have a sign up. I don't, you don't have to sign up or anything. There's about a 60 seat capacity. So that should work out for our group. And then it's broken up by full and reduced. So.
Okay. And then if I understood correctly, there's going to be a website that we can, if we can't make it down to Phoenix, we can sign in that way.
Yep, it'll be probably similar to this or a Zoom call where you're seeing the screen and that kind of thing.
Okay, thanks.
And yeah, no problem. Don't choose core because that's not going to include all of the Arizona specific data elements. So when you go to submit data, that's going to be missing a lot of the data that we need. And then Alejandra. I don't know if you meant to raise your hand. Alejandra, did you have a question? Okay. All right. Any other questions? I know we have quite a few follow-up items. I'll follow up with Jody and the team and then get back to you guys on those. Let's see. And then I'll stay on for Brandy. Anything else before we are done? All right. Thank you guys. Thanks for your patience. Always feel free to reach out to me with issues you're having. And I think that's all. Thank you guys.
Thanks.